I like taking care of people. The parts of it that bother me are starting to outweigh the parts that I really love.
People come into healthcare for a lot of reasons, but I think connecting all of us, there's joy and compassion, wanting to connect with families and with patients, and really feeling committed to bringing people back toward health.
I think that healthcare has a gravity to it. There can be life and death stakes in what we do, and that can be overwhelming for anyone because it's humans taking care of humans ultimately.
The environment is very demanding. And the folks who are drawn to that work really have a high level of expectation of themselves.
I think all of us just really want to do the best job every day. And that takes a lot of you.
In some ways, it's a wonderful experience, but it's been much more challenging than I ever imagined.
There's less time to focus on the things that I thought were important and that I think patients think are important. To me, the important thing is talking to the patient, taking good care of them.
There are burgeoning administrative and documentation tasks to be performed. And there are productivity expectations that turn our office visits, our hospitals into assembly lines. We're not building machinery here. We're attending to human beings who are anxious, who are vulnerable, who are ill, who are worried, who have families who love them.
I think that there is a culture of medicine that you just keep giving no matter what.
When you're not at work, you're still working because your mind is there. When I get up in the morning, the first thing I do is I check my emails. Is it healthy to always be connected? I don't think so.
Stress, crabbiness, shortness, lack of patience, limited empathy, health issues, poor sleeping, you name it.
I'm more agitated with my kids. I'm more agitated with my husband. I have sleepless nights sometimes.
And I thought, am I alone in this? Like, am I the only one feeling this way?
I remember the feeling of embarrassment and isolation and upset and just worry that other people were fine and I was the bad one or the wrong one or the one who couldn't cut it.
I would come home at the end of the day and I would be incredibly stressed out. Simple demands at home seemed incredibly overwhelming, like figuring out what to make for dinner and figuring out if I had enough time to exercise. It's rare that I feel carefree. And I really miss that.
There's people out there struggling day to day. And I worry about them.
It does impact me psychologically when I don't feel I can provide the best care.
When our creativity is diminished, when we don't feel as joyful or compassionate in our work, we aren't able to show up for families and patients or teammates or coworkers in the way that we all intended to be here.
We really don't touch base with an employee on kind of a personal level about what their challenges might be. There's just an expectation that you're going to figure it all out, and that's not very realistic.
It's not going to be sufficient to think that any one individual, by taking care of him or herself, is going to be able to really resolve the issue of burnout. We need systems of care that support our ability to connect with patients and their families, because that is what drew us to medicine in the first place.
I think that it would be really great if there was a sense within the healthcare field that you had to be intentional about creating time and space for you along the way.
I think that you have to have permission to say, I'm a great employee if I don't sit at my desk and eat at lunch.
If someone in very high leadership responsibility position would actually come to people and say, what are the barriers to your being efficient and productive and happy? What are those? And Let's see what we can do to fix those.
We can create the change we want to see. We just have to have the courage, the resolve, the smarts, and the research behind us.
I think a healthy organization doesn't pretend it has all the answers, but is curious enough to put itself out there and invite feedback to work on creating some sort of change.
I think is tremendously empowering to know that people have really listened to you, taken your suggestions seriously, and are working on a solution. I think is super important. The fact that we are now having these conversations is very helpful. I think that this gives us the chance to make things better.